It's Monday, January 10th, 2011. In this week's BeakerBeat, leaving so soon? A top FDA official is leaving the building, where he's going, and what this means for life sciences companies. Plus, an influential anti-vaccine study is declared a fraud. And a look at life sciences high-tech advances and low-tech stumbles. All that and more in this week's edition of BeakerBeat. Hello everyone, welcome to this week's edition of BeakerBeat. I'm Mike Justice, thanks for tuning in. Well, it is the start of a new year, lots of resolutions out there that I'm sure some of you are already starting to break. But there's also the issue of job changes, and there's a very big one at the FDA. After less than 2 years on the job, FDA Deputy Commissioner Joshua Sharfstein is leaving the agency. He accepted an offer from Maryland Governor Martin O'Malley for the top public health job in that state. The role is familiar territory for Sharfstein, who served as health commissioner in Baltimore while O'Malley was mayor. Sharfstein told the Washington Post, quote, "I was committed to the FDA, but opportunities like this don't come along very often." Sharfstein has long been a nightmare for naughty drug and device makers. He once served as an investigator on many public health issues, including off-label drug marketing and pharma gifts to physicians. He also pressed the FDA to reevaluate the safety of cough and cold meds for kids. The Wall Street Journal notes that since his arrival in late March 2009, when he was briefly acting commissioner, Sharfstein has shaken up several divisions of the agency, notably drugs and medical devices, pushing for stronger safety standards and better compliance. Take the probe into the controversial 2008 clearance of Region Biologics knee implant. That probe led to the agency's decision to put the device through approval again, which in turn prompted the rescission of the clearance. Agency Chief Margaret Hamburg has tapped an interim deputy commissioner. John Taylor, who's been serving as counselor to the commissioner, will step into the role for 60 days. He has 20 years of experience on FDA-related issues, serving at the FDA during the Clinton years and both Bush administrations. He also worked with former GOP Congressman Jim Greenwood, who is now at Bio, so he has experience dealing with Republican leaders, something that could come in handy with the new Congress. So tell us what you think about this story or any story that you see in today's show. It's very simple. Click on the orange button below me, box will pop up, type in your comment, send it to me. I promise I'll read and respond to every one of them. And when you're done watching BeakerBeat, check out Beaker's blog and read about drug company whistleblower Cheryl Eckert and her experience trying to fix problems at a GSK factory that made her a key figure in a federal lawsuit. Plus, could Johnson & Johnson be grooming its next CEO? They promoted 2 potential candidates that may be in line for Bill Weldon's job. Those stories and more on Beaker's blog. So as we all know, every action has a reaction, and that's now happening with Roche's Avastin, after the FDA pulled Avastin's approval for breast cancer treatment. Starting January 29th, a Medicare coverage contractor with customers in 6 states will stop paying for the drug when it is used in breast cancer patients. The New York Times reports it's the first official repercussion from the FDA's ruling that Avastin's benefits were too small to outweigh the risks. The decision applies to patients who start treatment January 29th or later. Women whose treatment has already begun or who will start before that date will still be covered. This decision contradicts previous assurances that reimbursement wouldn't be changed until Roche had its chance to appeal. Regular BeakerBeat viewers will recognize this story, but this past week it became international news. The British Medical Journal has concluded the infamous Vaccines Cause Autism study, published in 1998, was based mostly on fake data. The article shows how lead investigator Andrew Wakefield molded his data to fit his ideas rather than the other way around. The study had already been discredited by The Lancet about a year ago. That's where it was originally published back in 1998. Now, 10 of his 12 co-authors retracted their conclusions, the BMJ said, but Wakefield refuses to do so. The original study led to panic by thousands of parents and subsequently reduced vaccinations globally. This has led to an increase in children suffering from diseases that could have been easily avoided. Still, many parents stick to Wakefield's claim, as does the man himself, who told CNN that his findings had been replicated in other research. Quote, "The study is not a lie," he said. Time for some quick hits now, and Roche gets the nod for a pain med that could become a blockbuster. Roche's Actemra, a rheumatoid arthritis drug, was approved for inhibiting joint damage and improving function in moderate to severe forms of the disease. Previously, it had approval only for patients who hadn't responded to other therapies. Winning the new indication allows it to compete directly with the likes of Enbrel and Remicade. Those drugs are among the world's top-selling meds, with $6 billion in sales each. Abbott Labs' Humira also brings in $4 billion. Roche is counting on getting a piece of that pie, as are analysts, who predicted peak sales of about $5 billion. The FDA is still trying to be clear. The agency has been phasing in some transparency initiatives to make it easier for industry and consumers to get the answers they need. The latest round is Phase 3, focusing on regulated industries such as drug makers and food companies. The plans offer 19 initiatives to make dealing with the FDA simpler and less aggravating. Intel and GE Healthcare have launched a joint venture company focused on the emerging market for medical home monitoring systems. It will also focus on residential support technologies based on sensors that send alerts in case of a fall and other applications involving movement detection. According to HHS's semi-annual regulatory agenda, making device makers join the 21st century will be costly. Requiring device makers to submit medical device reports electronically could cost the FDA and the device industry more than $100 million. The one-time cost of modifying the process is expected to range from $81 to $101 million, and that is not including the annual cost of maintaining the submissions, including renewals and the price of high-speed internet access, which could reach nearly $9 million. A new report shows healthcare spending growth slowed last year, thanks recession, but that spending still amounted to 17.6% of U.S. GDP. Meanwhile, spending on drugs grew by 4%. A study of nearly 112,000 patients with implantable heart defibrillators found that 22% of the implants were given to those who were not fit to receive the devices according to guidelines. Current guidelines say patients who have had a bypass surgery or a heart attack shouldn't be considered candidates for the devices. Checking money matters, and 2 years after Pfizer inherited Wyeth's Discovery Pact with Denmark's Santeris, it's adding more money to the pot. Pfizer will pay $14 million in an upfront fee and promising up to $600 million more in milestones to expand the deal to develop RNA-targeted drugs. Santeris got $17 million from Wyeth for their original pact, struck in early 2009. Boston Scientific has finalized the purchase of Sadra Medical. Sadra got $193 million in upfront payments from Boston Sci and could get an equal amount in additional fees if it meets regulatory and sales milestones. Fresenius Medical is buying Euromedic's dialysis service unit for $647 million. Fresenius is the world's biggest provider of kidney dialysis, and this deal will help them expand in Eastern Europe. Kalorama Information has a crystal ball, apparently. The company predicts that the medical device market will pass $300 billion in sales in 2011. The sales will come from device innovations and an aging population. That's up from $290 billion in 2009. Finally this week, we leave you with two stories that exemplify the life sciences industry and how it has a presence in both new technology and old technology. First, the new. Sanofi Aventis and Novartis have both introduced new Android apps, albeit in a safe, conservative fashion. Novartis has a technical app for healthcare pros, aiding with prescribing info, documents, and a direct line for inquiries. This app isn't likely to attract an FDA crackdown, but with that FDA scrutiny in mind, along with a lack of guidance on what is okay, the other apps are simply disease-oriented. There's a flu finder app and a meal app to help diabetes patients. The global market for medical apps for mobile phones doubled last year to about $84 million. That's according to market research firm Kalorama, which attributes the rise to greater use of smartphones by healthcare professionals. Well, duh. And now the low-tech story, and how, despite incredible progress industry-wide, there's still some things that are hard to perfect, and they could lead to a big surprise. A Merck birth control implant is taking heat in the UK, where about 1,600 women have reported adverse events over the last 10 years. Of those women, about 600 became pregnant. Merck's Implanon had been cited in connection with over 2,800 suspect reactions in all, with most side effects involving pain at the site of the 3-year implant and subsequent scarring. We must note that these reports came over the span of a decade when 1.3 million units of the drug were prescribed, making the drug, quote, more than 99% effective, according to a company spokesman. Know what else is more than 99% effective for birth control? This face. Besides, if you're worried about getting pregnant, just use the old tried and true method. Rhythm method. It works every time, right? Anyway, that's it for this week's edition of BeakerBeat. I'm Mike Justice. Thanks for tuning in. We'll see you next week. Sit, Beaker. Sit. Good dog. Well, what about intercourse? Standing up? That doesn't... No? Jumping up and down? No?